right, welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Sara Smucker Barnwell. She is a clinical psychologist and she is a clinical director of behavioral health at 98.6, which is an on-demand text-based primary care app. She wrote the Kevin MD article, Debunking Common Virtual Therapy Myths and 4 Tips for New Patients. Sara, welcome to the show.
Thanks so much. I'm delighted to be here.
We'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Surely. Well, I'm a clinical psychologist by training, and I've worked in the telehealth space for almost about 20 years now. My great passion was access, ensuring that we promote access to evidence-based behavioral health care to anyone who needs it. Too often, clients are not able to access the type of care that they need, the type of specialist that may best suit them because of diverse reasons. Perhaps it's geography, perhaps it's other physical or medical limitations that prohibit their ability to access that care. So for me, telehealth was an obvious match. I've had this really fortunate and fun career wherein I've worked in a diversity of circumstances, inclusive of academic settings. I was director of telemental health for VA Puget Sound healthcare system for many years, and in recent years have been working in private industry, again, with the explicit mission of increasing access to evidence-based mental health care for everyone who needs it.
When it comes to behavioral health, I think telehealth is an ideal match given the lack of access in many parts of the country. Now, before the pandemic, what were some of the barriers that prevented telehealth from really becoming more in the mainstream?
That's a great question. And, I think that some were quite practical logistics. So, at that time, having adequate infrastructure in terms of technological applications that facilitated connecting patient and provider, having adequate support from legislative bodies to help, navigate some of the issues around practice remotely. And then I think there was just also adoption. I mean, we've seen telehealth democratized meaningfully over the last year and a half, wherein people previously may have had hesitations. And when I say people, I mean both provider and patient. That all of a sudden this really aligned with what people needed for their behavioral health care. And as such, we saw people really having a willingness to adopt. We saw technology rising to meet the challenge and giving us different ways to support the milieu. And we saw our legislators step up and really support us, ensuring that not only could care be delivered, but it could be covered by people's insurance.
Now, if and when the pandemic ends, what do you see are some of the lasting effects when it comes to the telehealth space?
I believe that we will, moving forward, see a hybrid model of practice. Sometimes folks speak in terms of, well, when pandemic is over and things go back to normal. And I think that may, not be how this proves out, that indeed we will see moving forward meaningfully that clients want telebehavioral health, that providers want to provide it. And so I think that we will see an adaptation where in practice really does look different, that we can anticipate having in-person clinic as well as remote clinic meaningfully. And as such that we should be investing in schedules, in equipment, in the infrastructure to support that type of adaptation.
All right, let's transition now to the Kevin MD article that you wrote. It's titled Debunking Common Virtual Therapy Myths and 4 Tips for New Patients. Now, for those who didn't get a chance to read that article, can you just walk my audience through it and share the story of why you decided to write it?
Absolutely. Well, in my role, I've spent over the years, I've had many opportunities to work with clinicians who are either beginning to develop a telehealth practice, or perhaps in the circumstance of the pandemic, they were thrust into needing to deliver telehealth to their patients, or alternatively, they're thinking down the road and saying, okay, this is going to be here to stay. And, a lot of times there are concerns, that they hold, themes such as, will virtual therapy be as effective? Will my clients feel as connected to me? And so I really wanted to take a moment to really speak to those clinicians, because I think, the good news is, the answer to most of these questions are more positive than perhaps people may have anticipated. So indeed, in the clinical literature, we see that most outcomes are pretty comparable in video conferencing conditions compared to in-person conditions. And even in some telephone-based studies, we see very highly effective behavioral health interventions being delivered remotely. We see tremendously high levels of patient satisfaction and the capacity to really establish clinical engagement through a distant milieu. And I think that that's really important for folks to know, because I think there has been this reticence of either initially adopting or alternatively staying in the milieu. Am I giving something up? Am I delivering, a high standard of care to my patients? And I think that when we look to the clinical literature, we find that we really are, and that we can have some of the best of both worlds. We can have good clinical engagement, we can have sound clinical outcomes, and we can have that increased access that is so important in the current context.
Now, I'm a primary care internal medicine physician, and last year during the pandemic, we are just kind of thrown into this virtual health environment, really without any training. Now, for those clinicians out there who continue to do virtual health and especially behavioral health issues on a telemedicine platform, what kind of advice can you give to these physicians who really have no background or training in doing that?
I think really invest some time. And it's a daunting task, and it can feel like it's a steep learning curve. But once you get there, maintaining those competencies is pretty straightforward. So I mean that in the most practical and mundane of ways, such as make sure you have a place in your home that is private, that is quiet, that is appropriate if you're working out of a home office, as many people have. If you're in your professional office, ensure that you adapt that space to work well for the type of distance milieu you're delivering care in, be it telephone, be it video, be it text-based, whatever the case. Invest in the technology, invest in the space. This is very silly, but get a good chair. Ensure that your ergonomics are set up in a way that this is sustainable. Additionally, be thoughtful regarding how you're going to collect documentation, how you're going to communicate with patients in between meetings, how you're going to manage themes such as payment and insurance submission without the patient physically present. And I think the investment in a thoughtful administration of these themes creates a more seamless experience for the patient and creates a lot less stress for the provider. So it really is that investment of time. Go ahead and take a CE on it. Goodness knows there's quite a few right now. Maintain those competencies and invest time and invest in your infrastructure to make sure that you are meaningfully set up to do this in the long run.
Now, in your article, you also talk about tips for patients. Now, from the patient perspective, what are some tips and advice that you could give them to get the most out of their virtual visit?
Absolutely. I mean, some of these would be very similar to, what I would advise someone seeking in-person care. But I think perhaps these issues are heightened somewhat in the context of distance therapy. And that is, take the time to find the right fit for you. Read the provider biography, ask questions. When you go to that initial meeting, a behavioral health clinician, is aware of these issues. We are very much aware that the client needs to feel a sound rapport. They need to feel a good connection. And if that doesn't feel right to you, it needs to be a theme that you're allowed to talk about. If you would prefer to meet with someone of a specific gender or of a specific cultural background, or someone who shares some characteristic with your own background, I really want to encourage folks to say, that's okay. You're allowed to ask for what you need. And I think, again, being prepared to put in a little bit of time so that you make sure that you have the best match possible. Be prepared to find a comfortable private space in your home. A year and a half ago, I had never met with a client in their closet or in their car. Now I have, and we do what we can. But I think, again, if you're going to meaningfully over time receive care remotely, thinking about where that could happen, and this is a privilege, to have space and to have access to something like this, but trying to find a space that is private, that is comfortable, I think is going to be more conducive to doing the work you need to do. Be ready to ask questions. And, again, as always, it's the same as in in-person care, realizing that I think in therapy, a lot of the work happens in session, but perhaps even more happens between sessions. So there's the good work that you're doing with your clinician, but then there's the actual sort of realization of the changes that you're working to see in your everyday life. And so come with that benchmarked expectation that you will be working in between those sessions, until your next clinical meeting.
We're talking to Sara Smucker Barnwell. She is a clinical psychologist and clinical director of behavioral health at 98.6, which is an on-demand text-based primary care app. Sara, for those clinicians who want to make virtual care a more permanent part of their practice, what kind of advice can you give to these physicians going forward?
It's a great question. I think there are themes such as what will your relationship be to your intake process? Do you want to meet with clients exclusively remotely, or do you prefer to see them in person first? How are you going to assess appropriateness for virtual meetings? There are few evidence-based reasons to exclude someone from remote care. That being said, people have their own preferences. So some clinicians prefer not to see clients who are, experiencing emergent symptoms remotely. Others do. But I think each clinician would need to think through what their inclusion-exclusion criteria for remote care would be, determine how they'll navigate that intake process. How will you respond to emergencies? Always ascertaining a sound emergency plan, ascertaining where that client's going to be, what emergency services you would contact for the client in case of emergency. Again, in advance of anything emergent happening will make life much less stressful. And then thinking about what your relationship to physical space will be. Will you continue to maintain a physical space for those clients that either do not fit what you believe is your inclusion-exclusion criteria for remote care? Will you want to be able to see somebody in person on some specific interval? How do you want to navigate that? So I think being thoughtful about your inclusion, exclusion, your physical space, and then how you're going to navigate themes such as intake, such as documentation, such as emergent circumstances, I think would probably be the best advice I could give.
Now, from a financial standpoint, how viable is it for a clinician to have a completely remote practice, whether in primary care or behavioral health?
I think it's tremendously viable. From a financial perspective, certainly your overhead costs are fewer because you don't have the same demand for physical space. You'll, of course, need to invest in technology products that will support the practice and make sure that you have smooth over some of those rough edges of how to communicate and capture documentation appropriately. I think folks find that their referral sources and outreach may differ somewhat. So for their in-person practice, perhaps they had one referral source, but they find that for the remote practice, they're working with other referral sources. And I think that takes some time and some investment of relationship building to ensure that you are well connected to those referral sources that have the types of patients, who want to be seen remotely, who, would benefit from this care. I know some folks work explicitly with certain communities that have limited access to behavioral health. I know when I was in the VA system, that was a strong focus, was doing outreach to our communities who maybe didn't have local behavioral health resources. We were sure to really know those primary care clinics. We were sure to really know those EDs to make sure that we could bridge those gaps and help the patients get the care they need. So I would say it's absolutely financially viable. There have been changes in legislation that have allowed for reimbursement with parity for telehealth services. That may be shifting somewhat in the coming months. So that's the one thing people want to keep an eye on, is that there were some provisions allowed that reimbursed telehealth services at the same rate as in-person services. And now there is some question as to whether or not that will remain. So we're seeing a lot of movement on that front. So that's the only thing I would say to keep an eye on, is that insurance reimbursement legislation.
And my final question, what's your take-home message you want to leave with the Kevin MD audience?
My take-home message is, I think if you have an inclination to do this work, it's tremendous work. It is an opportunity to deliver evidence-based behavioral health care to folks who would never have access to it otherwise. For me, that's why I got into healthcare, was making sure we connect the right patient with the right provider and really help them get better. That's it. And I think that this is a wonderful vehicle to do it. And I really want to thank everybody for the good work they do and encourage them to, keep on keeping on.
Sara, thank you so much for joining me and sharing your time and insight. And thanks again for being on the show.
Thanks so much for having me.